You know, right now parts of Africa and South America are dealing with several outbreaks of yellow fever. Now, this is a potentially deadly disease, and right now researchers at SLU are working to develop a new vaccine. And right now we are joined by Dr. Sarah George, Professor of Infectious Diseases at SLU's Center for Vaccine Development. Thank you so much for being here this morning.
Thank you.
We really appreciate it. Can you talk about how do these outbreaks actually impact people here in the U.S. and especially St. Louis?
Well, fortunately, we don't have this disease in the United States, but it is transmitted by mosquitoes in parts of South America and Africa. So if you are traveling to that area, or if you are military being deployed to that area, you need a vaccine for it.
And I remember I actually had to take the vaccine a long time ago because I was going to go to Ethiopia to escort a baby for an adoption agency. So I took the I definitely remember taking this vaccine probably 15 or 20 years ago. Never ended up going, but just in case.
Are there any side effects, or were there then?
There always can be side effects with any vaccines, you know, like the flu shot, you can get a sore arm, some people get headaches and some other things.
Okay, so would this be a new vaccine for yellow fever that we're talking about here?
Well, we're testing a new vaccine against the existing licensed vaccine, which has already been used for decades in 600 million people. The new vaccine is the same one, slightly lower dose, and made without any eggs or animal products.
And that I was going to say, because we've had this yellow fever vaccine for a very long time. Why do we need one? And is it because of the eggs or because people, why do we need a new one?
We need a new one because people with severe egg allergies could have problems with the existing vaccine, which is made in eggs. We also need a vaccine we can make faster. Back in a very bad yellow fever outbreak about 10 years ago in Africa, we ran through the entire global supply.
Wow.
Wow.
Okay, so yellow fever, maybe you already said it. What are the symptoms?
The symptoms of yellow fever, which you cannot get in St. Louis, only in some parts of Africa and South America, are fever, headache, nausea, sometimes vomiting, fatigue, feel awful. And most people recover, but some people do progress to a severe form of the disease where they can die.
Wow.
Oh my gosh.
Wow.
Yeah, that's what I was going to ask. How severe can it be? So let me ask you something. I know that you're looking for people to participate in this trial. What does that look like for folks?
That looks like if they are interested in volunteering, they would contact us at the Vaccine Center. The number is 314-977-6333 or vaccine@slu.edu. And indicate whether or not they'd like to be in the trial. They would get one dose of vaccine, either the licensed one or the newer one, and then we follow them up for 6 months with several visits and phone calls just to make sure they're doing okay.
And how important is it to have, you know, people in trial being a part of the solution for this vaccine?
Well, it's very important for this and all vaccines because this is how we finally determine whether or not we can get new and licensed vaccines, better vaccines for flu, for anything.
Okay.
Okay, and okay, so since we're talking vaccines, right? COVID vaccine of the last 5 years, do you still encourage people to get it, the booster, those type of things? I know you're not really here to talk about that and I'm putting you on the spot.
That's fine. We do still encourage people, particularly people with weak immune systems or older people, to get the COVID booster when it becomes available this fall.
Okay. All right, great info.
I do have some more follow-up questions.
Go ahead.
As we're just talking about this, because it makes me think, how often is SLU a part of a solution like this? Because is SLU the only one doing this yellow fever vaccine trial? Are there other universities and institutions doing this as well?
Yes, there are 10 sites in the United States doing this particular trial. SLU is one of the federally licensed vaccine centers where we do a lot of different vaccine studies, including the COVID trials back during the pandemic, flu vaccine trials, and many others.
Wow, okay. And I was going to say, do you have any others that people can participate in, or is this just the one that's available now?
There are definitely others right now. Don't want to go into the details, but you can find out by calling our number and we can tell you what's available.
And what would the benefit be for someone who wants to participate in the trial? Do they get compensation, or do they just get to be part of a solution and feel good about themselves, or maybe they need something like this vaccine anyway? anyway?
Well, they do get compensation
Okay.
for time and inconvenience because they're taking time out of their day and travel time and, gas or bus fare, whatever it may be. They do get to be part of the solution, and I hope that makes them feel good.
Well, we really appreciate your time and energy and just your information. This is so fascinating. I had no
It
idea
is.
that this was going on in our backyard, but sounds like it's been going on for quite some time.
Fortunately, not in the United States.
Yeah, yeah. Oh, no, I meant the trial. Sorry, I mean just the work that you do.
Thank
right,
you.
yeah.
Thank
Thank you so
you.
much. So again, if you would like to participate, just email vaccine@slu.edu. You can also call 314-977-6333. Thank you so much for being here this morning. Really appreciate it.
Thank you so much.
Thank you very much.
Thank you.
Great information.
Yes, great
Wow.
information.